There are nearly 24 different therapeutic options being explored to treat COVID-19. On this episode of Shareable Science Beyond the Blog, we'll take a snapshot of where they are in that process. Welcome to Shareable Science. Science you can share. Okay, everyone. It's now early November, which means we've been in pandemic mode for 9 months. Take a deep breath. I know it's long, I know it's challenging, but I hope that what I'm going to tell you provides a little bit of encouragement. I'm going to show you almost 24 different categories of medications that are currently in human clinical trials. That means they've moved through the early stages of lab research and now we're actually testing them in larger populations. The goal being to get a toolkit of medicines that work to treat COVID-19, some in the early stages and some in the later stages for individuals that have more serious disease. I'm going to refer you to these previous episodes where we actually talk about the biology of how these different medicines work, and we're just going to go straight into what the data are now telling us. So, broad categories. Let's start with antivirals. These are medicines that are designed to slow the spread of the virus as it infects cells and as it moves from cell to cell. This probably is most effective. These medicines are most effective relatively early in the course of disease. And I've broken everything down into, has it already received full approval? Has it received partial approval, but it's still in clinical trials? Or do we now have data that actually suggests that these are not effective or maybe only slightly effective? So, Remdezavir is the one medication that's received full FDA approval for treatment of COVID-19. The data suggests that Remdezavir seems to reduce the likelihood of, reduce the length of a hospital stay for individuals that have severe forms of COVID. We have a whole set of other antivirals, some that were developed originally for influenza, some that have been developed for parasites that are still in testing. Some of these are given intravenously, like Remdezavir. Some of them are given by pill. So I think within the next few weeks, we'll begin to see more of the readout of how this actually works. And then we have a set of antivirals that have shown very little efficacy, or may have shown some modest efficacy, but have some potentially significant health drawbacks. That doesn't mean that these aren't useful at all, but additional trials are going to be needed to see if there are certain subpopulations that would benefit, or if there are combinations of these medicines that might make a difference. All right, I'm going to move on to immune boosters. This is also relatively early in disease course that you would want to give immune boosters to help the immune system get up to speed and fight the virus. So, Convalescent Plasma, we've talked a lot about. This has received emergency use authorization under certain circumstances and in clinical trials. The data suggest that there are benefits, but it also depends on the timing and the amount of antibodies and the specific type of antibodies. So a lot of people are now focused on this next category, monoclonal antibodies, and we've also talked about this before. Two main groups are leading the way on this, Regeneron and Eli Lilly. And we've seen promising early data that suggests that their monoclonal antibody cocktail does benefit individuals relatively early on in the course of infection in helping boost the immune response. So this is before your body has had a chance to fully build its own immune response. You're kind of priming the well. And then there's some early data about interferons that's a little less advanced, so we're going to have to wait a bit longer for that. Okay, now let's talk about later in infection. We've talked about the fact that your immune system in certain individuals over-responds. So most people that get COVID-19 get the viral form, and then their body treats it and they have no more symptoms and they recover. But some percentage of individuals go on to a deeper response where their immune system goes into hyperdrive, the cytokine storm that you've heard about. And these medicines are designed to try to tamp down that overactive immune response. Dexamethasone has shown a lot of promise. It's an existing corticosteroid. It's relatively inexpensive, and it seems to be good at tamping that down. We're waiting for final data, and then we'll see what the FDA does. There are also medicines that inhibit the cytokine storm and even technologies, blood filtration systems that pull the cytokines out of the blood to try to cool the immune response. Those have received emergency use authorization. Again, we've got to wait and see where this goes. And then there's some data in clinical trial right now with stem cells, specifically stem cells that secrete molecules that cool or slow the immune response. And then we've got one last category that's kind of a catch-all of multiple different things. And this includes anticoagulants. So we know that certain individuals later in the COVID disease course actually have blood clots, and anticoagulants are used to break up those clots. The question here is, should they be given earlier in infection to prevent the formation of clots? So we'll wait on the clinical trials to tell us that. And then there are clinical trials on a set of supplements. Vitamin C, which we know is involved, vitamin C and vitamin D, which are involved in the regulation of the immune system. Zinc, which seems to have some antiviral properties. So there are clinical trials underway right now to investigate this, to look at dosing, to look at timing, to look at if it's in combination with other molecules or not. And then we know that drinking or inhaling bleach or disinfectant is not effective. And we also know that silver solutions, these things that you may see on the internet, silver-based or silver colloidal solutions, are also not effective. So here's my final cautionary note. Some of these things that are in the yellow category, you may have in your medicine cabinet. Now, you probably don't have blood filtration systems, but you certainly have these. I would just caution you about taking these without talking to your doctor first. Everything I'm showing you on these boards is right now being done in the context of a clinical trial, which gives us more than just, hey, I thought this worked. It gives us the scientific evidence we need in order to take it to larger populations. I want you to be encouraged by what's on these boards. We are slowly giving physicians better toolkits, either to prevent the disease from becoming worse or to help treat the disease when it does become more serious. I hope you find this useful and encouraging. Please share this with others that you think might also find this valuable. Thank you for watching. I look forward to seeing you on the next episode of Shareable Science Beyond the Blog. Take care.